Everyone. Thank you for attending our first session of Friday morning public policy information over the next 3 Fridays. We have the pleasure today of hearing from Robyn Linscott, who is from the ARC United States. She's currently the Director of Education and Family Policy at the ARC in Washington, D.C. She handles all the legislative and administrative policy issues surrounding early childhood, K-12, higher education, child care, child welfare, and paid family leave. Prior to her work at the ARC, she worked in Senator Kamala Harris's office, working on these same issues. And then before that, she was a teacher in New York City for 8 years, teaching students with disabilities. We're excited to have her here. She knows a lot of stuff, and so I'm going to turn it over to her. Thank you, Robyn.
Hi, thank you so much, Sherry, for that great introduction, and thank you, ARC of Michigan, and all of you attending for having me. So I wanted to be able to give both a high-level overview and at some points brief update of some of the many things going on in Washington. I do know that for many people, issues like Medicaid and SNAP and things going on with this big, beautiful budget bill and hearing this word reconciliation might be top of mind. And so I wanted to definitely include those things in my presentation, with the caveat that I am not the Medicaid expert on our team. I worked with our Medicaid expert to make these slides. I'm happy to point you in the directions, obviously kind of following this process, definitely aware of what's going on, but, some nitty-gritty Medicaid details, we're happy to pass you along to Kim Musheno, who is our Medicaid guru, but definitely going to give you a little bit of an overview of what's happening. Somehow, as soon as I said Kim Musheno's name, she appeared on the screen. So first thing I want to talk about a little bit are kind of at the ArcUS, what our public policy priorities are. So our top focus is Medicaid, Social Security, education, appropriation, so how DC is kind of doling out money, and building our coalition. So the work that we do with other groups to make sure that our message across the kind of big D disability world is being spread in Congress. Next slide. And Kim, I didn't know you were going to be joining me, so please feel free to pop in at any moment, because I was just telling the audience that I wanted to make sure people had the context of what's going on with Medicaid, but I was not Medicaid expert, and just like magic, as if I summoned you out of thin air, here you are. So this is so wonderful.
Only if you want me to, but yeah, I mean, the political context is, makes it easier for the Republicans to enact their agenda, because they have a trifecta, meaning the Republicans are in the majority in the presidency and both the House and the Senate. However, they have very narrow majorities in the House and the Senate, making it very hard to get bills through without having some bipartisanship, or trying to get their entire caucus in line with their agenda. And the House and Senate have all types of Republicans that are all over the place. So that's making it difficult, but that's one thing they have in their favor, is a trifecta. There's also just a focus on reducing the size of the federal government in general, writ large. And so you see, DOGE being used to slash full agencies. That's part of this agenda. And then also reducing spending. So that means cuts, and renewing renewing the 2017 tax cuts is their number one priority over everything. And so that's kind of where we are in the political context. And that we're working with as advocates.
Next slide.
So why is Medicaid important? I don't think we have to tell you that Medicaid impacts almost 80 million people, providing health and long-term services. It also helps people, get to work. A lot of our optional services are used to provide supported employment and personal assistance and respite care, and so on. And of course, it's our largest payer of long-term services and supports, including home and community-based services. And we know we don't have to tell you about that. And and as you know, Medicaid is a federal and state program. So the federal government provides a federal match, which is different throughout the country, anywhere between 50 and 85%, depending on the population, wealth, or income levels. And so states have a lot of flexibility in providing their services. So that's why some people call us and say, hey, what state should we live in? And and so frequently we look at how they're operating their Medicaid program, because it's so important to our population. And they have a lot of flexibility in excuse me, setting eligibility rules and what services to provide, what optional services to provide. And then, of course, some states have 41 states have opted to expand Medicaid to those in the range of up to 138% of the poverty level, and some states have not. And we know Medicaid is a target. Why is it target? Next slide. It's a target because if Congress wants to, if their goal is to reduce the size of government and to reduce spending, then they look at the overall budget and see where are the big spending buckets. And of course, those are Social Security, Medicare, and Medicaid. Since Social Security and Medicare are so popular and considered untouchable, then they look at Medicaid, which has historically not been as popular, except that now it is. Ever since the Affordable Care Act expanded Medicaid, it touches a lot more people. And the Republicans I think, are kind of caught off guard by how popular Medicaid is. It touches so many more people. In fact, 70% of Trump supporters do not want to see cuts in Medicaid. But since they have to pass, since their number one priority is to cut spending and pass an expensive or extend the tax cuts that are quite expensive, they have to find other areas in which they can make the cuts, and Medicaid is one of the big pots that they're trying to use. So they're using this process that is so nebulous and complex called reconciliation. All that means is that it's a budget process that can avoid a filibuster. That means they can avoid needing 60 votes in the Senate that is required to overcome a filibuster. And of course, the Republicans have to have a 53 vote majority in the Senate, so they can't do it they wouldn't be able to do it without bipartisan support otherwise. But reconciliation is also more complex, and they have different rules. They have to abide by what's called the Byrd rules, which means it has to have a budgetary impact. So provisions that don't have a budgetary impact could be knocked out. And but reconciliation is used often for high priority legislation, especially in times when there is a trifecta. In fact, it's how Democrats got the Affordable Care Act through Congress, and it's how the Democrats got the Inflation Reduction Act through Congress, was using this special process. And so that's where we are now in the reconciliation process with the budget bill in the Senate. So the current status of the reconciliation bill is that the House narrowly passed the bill 2015 to 2014. So really one vote, very close, very partisan, along party lines. And the president one time called it the big beautiful bill, and so one big beautiful bill, and so then they literally named the bill One Big Beautiful Bill. And they did it overnight while we were sleeping. We woke up and they had passed it on the House floor. They also did their markup in the Energy and Commerce Committee during the night hours. We were there, right, Robyn? Not on by long. I need my
what did it
sleep.
end up being? 30 hours, 32
I
hours?
think that one was 26.
26.
Yeah, but then there was the Rules Committee, and I can't remember how many hours the Rules Committee was, but that was also during the night. So there's a pattern here where they don't want us to watch what's happening. In any case, the House did pass the reconciliation bill that with these cuts to Medicaid very narrowly, and now it's up before the Senate. And we expect changes in the Senate. Senators have indicated that they want to make changes, which means the House will have to vote again. So our targets now are both the House. While we're focusing on the Senate, we can't not focus on the House too. So we have to hold representatives who voted for this bill accountable and try to get them to change their mind when it comes back. And then we also have to focus on the Senate and try to pick off 4 to 5 senators and to vote no. There's already some that are saying they're going to vote no based on the fact that it doesn't that they're concerned about the debt and the deficit, and this bill will contribute significantly to the debt and the deficit.
Yeah, I think it's important for us to point out that in the last even 48 hours, we've kind of begun to see a little bit more of this fractioning among Republicans over kind of two different groups forming that are not necessarily in support of this bill. Kind of one group saying they're not supportive of this bill because it would take away potentially Medicaid and SNAP benefits from their constituents, represented or senators like Senator Murkowski of Alaska, Senator Collins of Maine, Senator Hawley of Missouri. And then you have another group of senators that are saying, this bill doesn't go far enough, it doesn't cut enough. And I think right now our strategy is a little bit of, we don't care why you're going to vote no on the bill, just as long as you vote no. So kind of a moment of interesting bedfellows amongst some folks who are opposed to the bill for kind of various different reasons. And if people saw in the last even 12 hours, Elon Musk has begun to express his anger with the bill. And so that is kind of also, I think, beginning to show a little bit more factions in the Republican Party. So potentially leaving us with some more opportunities to continue to get our message out about how this bill could be really harmful for people with disabilities.
Yeah, right now it's Senators Scott from Florida, Lee from Utah, Paul from Kentucky, and Johnson from Wisconsin, who have noted that they're going to vote against the bill because of the concern that it adds to the debt and the deficit. So, like Robyn said, we, worry that they will go along with the vote because this president has a lot of power right now and has been shown to be able to twist arms. But these new developments with the fracturing related to Elon Musk's opposition to the bill could make the president less powerful. Who knows? It's interesting politics for sure. So what's in the bill related to Medicaid? Well, a lot of the provisions that, they say attack waste, fraud, and abuse, but actually, when you look at it, that's very little that directly impacts actual waste, fraud, and abuse. Beneficiaries, don't get money that they can go and buy cars with. They're not. It's not beneficiaries that are related to waste, fraud, and abuse, but they're attacking beneficiaries. So this bill, generally the provisions make it harder to become eligible and to stay eligible. And some of the biggest savings that they call savings, or we call their cuts, are related to mandating work requirements that will have been found by the Nonpartisan Congressional Budget Office to impact almost 5 million people. And the work requirements are going to be mandated for those that are in the Medicaid expansion population. But studies have found that most people in the expansion population are already working. People on Medicaid are working. They might just not be working enough, so they still fit into a low income area. They're not working full time. They're gig workers, they're caregivers, they're people with chronic health conditions, or a lot of them are older women, and mostly and caregivers, frankly, that could be impacted. So we know that from past experiments in states like Arkansas and Georgia that work requirements don't work. They have instead just resulted in people losing coverage. In Arkansas, for example, within 7 months of trying work requirements, 18,000 people lost their health insurance, and not very many people got work as a result of it. The bill also freezes provider taxes at their current state, as well as directed payments. So kind of takes away states' flexibility to change the provider taxes or to increase them. And that's just going to make it harder to finance their programs. There's lots of concern that these changes to provider taxes will hurt rural hospitals and other healthcare providers. Basically, it's a big cost shift to states. All of these are a cost shift to states. That will lead to the state having to make up for those cuts by either raising taxes or taking away services. Of course, home and community-based services are vulnerable because home and community-based services are an optional benefit under Medicaid, and it's an expensive optional benefit. So we're concerned that this cost shift will lead to cuts in home and community-based services, leading to longer waiting lists and the possibility of more institutionalization, which we don't want. Other provisions in the bill include stopping until I think 2035 the recent regulations that were put into effect that we call the eligibility and enrollment rules. These were enacted to actually be more efficient, to modernize eligibility and enrollment procedures, and to make it to reduce the barriers that people are facing in becoming eligible and staying eligible. So that actually makes Medicaid less efficient, but it also it results in savings because less people will become eligible or stay eligible. And it shortens the retroactive coverage period, which could threaten financial difficulties for people who experience some sort of sudden health crisis or who need long-term care. Next. The bill allows states to apply cost sharing to some in the Medicaid expansion population. That's just going to put more people in, threaten that they won't be able to pay the cost sharing and not seek care. And then the cost sharing actually is up to 35% per service, but it does maintain the 5% family income cap on our out-of-pocket expenses. Another provision that will prevent people from being eligible is it requires states to conduct eligibility redeterminations at least every 6 months instead of annually. And anytime there's, as you know, that there's a redetermination, people miss the paperwork or fail to do something on time, and then they lose eligibility. And so again, this just is the theme of all of these provisions result in what they call savings and we call cuts because they prevent people from being eligible or staying eligible. So this is just a CBO estimate of potential Medicaid cuts in the bill. It's just kind of a nice diagram that shows where they're finding their savings over. This is over 1 year. So you can see that work requirements are the biggest. The eligibility rules are second, then provider taxes, then redeterminations, and then other. So 62 billion just in 1 year. Do you want to take SNAP, Robyn?
Sure. So SNAP, also known as the Supplemental Nutrition Assistance Program, used to be called food stamps. SNAP also takes a pretty big hit in this reconciliation bill. So currently, we have about 40 million people who are benefiting from SNAP currently. And the reconciliation bill would cut SNAP funding by about $30 billion or 30%. And one of, I think, kind of this, as Kim was mentioning, these themes is for the first time, we see a really significant shift in the cost to states. States have historically not had to put as much of their own funding into the SNAP program. And now they're going to be required to, be spending a lot more. I think many of you know, kind of on the state level, states are not able to to run in a deficit, right? Their budgets have to be balanced every single year. And so trying to share both the increased potential cost burden of Medicaid shifts and SNAP is really going to put states in the difficult position of having to find significant places to cut, from elsewhere. I think we also want to point out that at a time when we are facing, millions of people potentially losing access to their health insurance, they're also going to be losing access to food and to, access to healthy food. We know the connection between being able to, get enough calories and give yourself nutrients and being healthy. So these two things obviously, work to make the situation even more difficult. All right, so there's also a piece in the reconciliation bill that is getting a lot less press, but is still pretty significant. Obviously, for me in the education space, this is the thing that I've been working on the most within the reconciliation bill. There is a federal school voucher program within this reconciliation bill. It's based off of a bill that was introduced last Congress called the Educational Choice for Children Act. And this would actually be the first federal school voucher program. And when I say school vouchers, what I mean is that it is federal money being provided to families kind of through what they call a scholarship granting organization, so kind of an intermediary organization for parents to be able to send their children to private schools. Many states already have their own state level school voucher program, but this would be a federal program. It is $20 billion. So it's a pretty expensive program. This is not change you're finding in your couch cushions. And kind of some specifics of this program that make it pretty unique are that it's included in this bill because it is a tax incentive for folks to donate to a scholarship granting organization. So a person wants to donate $1,000 to a scholarship granting organization. They get a dollar for dollar match in their tax benefit. So normally, if I want to donate $1,000 to my local ARC chapter, right, I would be able to deduct my taxable income by $1,000, right? So that might save me, I don't know, $240, $300, something like that in the overall scope of my taxes at the end of the year. This is not just a tax deduction, this is a tax credit. So if you donated $1,000 to this program, if you owed $2,000 at the end of the year, you would now only owe $1,000. Or if you didn't owe any taxes, you would get $1,000 back from the federal government. So this is really creating kind of a privileged class of nonprofit organizations where it's going to be more lucrative for you financially and for you for your taxes to donate to these organizations than it would be to donate to your local church, your local veterans association, your local chapter of the ARC, your local food bank. The other thing is that in this federal voucher bill, people would also be able to donate stocks and securities. You might have a stock that has appreciated significantly. I don't know, let's say you bought some Apple stock in 1991. And if you cash that stock out, you are going to pay a pretty hefty capital gains tax. If you donate all those stocks to the scholarship granting organization, you get all that money back on your taxes and you get to completely avoid paying capital gains tax. So this is really a lucrative way for folks, especially folks who have a lot of disposable income, to be able to make these donations to lower their tax burden, which is why it costs $20 billion. The reason that we, as the ArcUS, are concerned about a federal voucher program is that private schools are not under the same obligations to serve students with disabilities as public schools or charter schools. Private schools do not need to abide by most tenets of IDEA, the Individuals with Disabilities Education Act, and religious schools do not need to abide by the ADA or 504. So historically, we have seen a lot of examples of, in states where there are voucher programs, students with disabilities not being able to benefit from that program, right? Students have not been able to benefit because private schools are able to say, no, we're sorry, we can't accept you because you have a disability and we don't have those supports and services for you. Or we have examples of students who have been in the school for a short period of time and maybe they've had a behavioral incident. And because there are no protections under IDEA, the school is able to just say, oh, you had one behavioral incident. See, yeah, you're going to go back to your public school. And there is some language written into this bill that is kind of trying to pay lip service almost to students with disabilities having this experience. It says that students cannot be denied entry into a private school because they have an IEP, but that language is kind of just in there to, like I said, pay lip service. There is no teeth there because there is no oversight mechanism. And that also doesn't protect students who might not have an IEP when they enter the school, right? And maybe the school begins to realize, oh, I think this child might have autism. well, there's no rule that says we can't expel this child because we think they might have a disability and that might be an expense on us. So we're going to ask that child to leave. So again, there is some language that is trying to recognize that students with disabilities have had this experience in the past with voucher programs, but it doesn't actually provide any protections. It doesn't tell the schools that they have to abide by IDEA. It doesn't make religious schools able to required to abide by 504 or the ADA. And so when we talk about private school choice, kind of in the federal context, it means that private schools get to choose their students, right? Families of children with disabilities are not able to necessarily have that same choice. Next slide. Kim, do you want to take this one or do you want me to?
I'm happy to. Regarding the reconciliation bill, there's just a lot of misinformation running around. So we try to clear them up because some of our members ask us, well, the president said that, he really loves Medicaid and is not going to touch it. And that's true. He said that, but then the very next week he said that he really liked the House reconciliation bill and thinks that, thought it should pass, even though it contains $800 billion in cuts to Medicaid. So the narrative that's being built around these cuts is that it doesn't hurt beneficiaries, that it's only focused on waste, fraud, and abuse. So that means that they're looking at, that they believe that there's a lot of people using Medicaid that shouldn't be on Medicaid. There's a narrative that there's a lot of so-called able-bodied people that are just sitting around loving being on Medicaid and don't want to, because they're getting free health care, then they don't want to work. And that's just misinformation, because as I said before, and you can see in the issue brief that I put in the chat, that most people in the expansion group on Medicaid are working or have significant disabilities that are preventing them from work or full-time work, or not getting they're not getting work that provides employer provided health care. Originally members of Congress were telling constituents that Medicaid wasn't mentioned in the budget resolution. Well, that's true. The original budget resolution is only a framework that tells committees to make the cuts. So Medicaid was not mentioned in the budget resolution, but it told the Energy and Commerce Committee to find $800 billion in cuts. And then, as I said, they're just talking about focusing on waste, fraud, and abuse. Well, there's waste, fraud, and abuse in a lot of healthcare systems, including private healthcare systems, and there are ways to deal with waste, fraud, and abuse. A general accounting office report made recommendations, and one of the recommendations is to make sure that CMS, the Centers for Medicare and Medicaid, are doing their due diligence to make sure that the paperwork is correct, that there aren't any improper payments, that all the I's are dotted and T's are crossed, and they have made improvements in that. But so there is a small percentage, but not what they are seeing. What they're calling waste, fraud, and abuse are things like providing states that choose out of their own state budgets to provide health care through Medicaid, through their own state budgets for undocumented workers. That helps prevent them from getting uncompensated care in hospitals. They're calling, like I said, able-bodied people for waste, fraud, and abuse. so also they're calling the regulations that modernize the eligibility processes waste, fraud, and abuse. So what they're saying is waste, fraud, and abuse, we would not consider that.
I think it's also, Kim, important, and something we've been trying to point out from the ARC is that there are a lot of people with disabilities that are on Medicaid through the expansion.
Yeah.
I'm sure many of you know that it's a pretty stringent definition to qualify for Medicaid through SSI.
Yeah.
And there are many people who don't, with disabilities, who don't meet the SSI definition of disabled, but receive but need supports and then are able to receive Medicaid because of an expansion. I've been telling the story of my brother Neil. My brother Neil is autistic and has multiple disabilities, and he just barely doesn't meet the SSI definition of disabled, but he was able to get Medicaid because he was living in Pennsylvania, which is an expansion state. Neil needs supports to be able to work in the community, but again, does not meet that SSI definition. But Neil was not able to get insurance through his employer, didn't make enough money to get health insurance through the ACA exchange, even with the subsidies. And so we do see a lot of people that fall into this category of maybe just don't quite, just barely kind of miss that definition of SSI, or for SSI to be able to qualify immediately for Medicaid. So I think there is this talking point out there a lot that, well, it's not people with disabilities, it's only people on the expansion. And there are people with disabilities on the expansion. So it's definitely something we've been trying to amplify those stories. They're a little bit harder to find because it's funny. My brother actually didn't even realize that he was on Medicaid through the expansion until my family moved to Georgia a few years ago, and Neil actually has not been able to get on Medicaid because Georgia did not expand Medicaid. And he said, well, I don't understand. I'm still autistic. My autism didn't go away when I moved to Georgia. And I said, well, Neil, it's not, you weren't on Medicaid in Pennsylvania because of your disability. You were on Medicaid in Pennsylvania because they expanded it, and because you were able to qualify based on your income limits. So trying to elevate those stories so members know that, no, there are a population of disabled people that you are talking about when you say this isn't going to hurt folks, because it's only the expansion population.
Thank you. That story is a really a perfect example. And yes, a lot of the work requirements are focused on the expansion population, and a lot of these provisions are focused on the expansion population. During the Affordable Care Act debate, in 2008 through 10, there was a lot of opposition to the provision that allows states to expand Medicaid to low-income individuals. It was historically, it was a way there's, at least 20 million people did not have a way to get health insurance. And Medicaid is a very lean and efficient program. And so that's why they used Medicaid to help cover a large swath of people that were not covered by healthcare, and it was costing states a lot to provide uncompensated care. People didn't go to get help until it was an acute health issue, and not getting preventative care. So there's still a lot of opposition by some to the expansion population, which is why they're basically trying to repeal parts of the Affordable Care Act through this legislation, and they're attacking those on the expansion population. So those that are, get Medicaid through the traditional and more narrow and very difficult pathway of SSI, they're not as impacted by this. And that's why members of Congress are able to say, don't worry, we are protecting those people, that the deserving and traditional population is literally what they're saying. And that what they're referring to is that narrow SSI definition because they continue to be opposed to the Affordable Care Act and the expansion of Medicaid to those with low income.
Yeah. But also let's not forget that even though this population of traditional Medicaid folks who qualify through SSI, that does not mean that the effects that states are feeling because of these budget crunches, whether it's through the Medicaid cuts, the SNAP cuts, aren't going to affect the services for that population, right? We know, Kim, you can talk about optional services, but those are optional services are usually kind of the first on the chopping block when states are facing a budget shortfall. And so just because this bill itself might not impact in this, directly, or might not mention that population of people who are on Medicaid through SSI, it doesn't mean they're not going to feel significant cuts because of the ways states need to readjust their budgets because of these massive changes. Next slide.
You want me to take that?
Yeah, I can.
Okay, go ahead.
So Congress returned from recess this week, and basically the ball is in the Senate's court right now. So the Senate is working to likely very much change this bill in a lot of ways. And because of all the changes that are likely, it will have to go back to the House again. And so we still have a long way to go, and we're kind of hoping that every second that we save, or every second that we can delay, is another second that we get to amplify the stories of how this bill could really harm folks with disabilities. So we are kind of focusing on the Senate and our Senate targets right now, while also keeping our House folks in mind, as Kim mentioned. All right, next slide. We're going to switch gears a little bit and move away from the reconciliation bill, even though that feels like it's taking up all of the oxygen in Washington, D.C. right now. And as education is my portfolio area and my foray, wanted to talk a little bit about some of the changes and some of the things that you might have been hearing about the Department of Education over the last few months. So earlier in, I believe it was March at this point, President Trump signed an executive order that directed the Department of Education to begin the process of closing the department to the greatest extent possible, recognizing that the Department of Education was created by an act of Congress in 1979, and so only an act of Congress can actually shut down the Department of Education. Nearly 50% of the staff at the Department of Ed have been fired or placed on leave. And this has resulted in significant cuts to the Office for Civil Rights, or referred to as OCR. OCR is a critical component of the Department of Education for folks with disabilities. If a family feels that their their student has been discriminated against in school because of their disability, they haven't been provided with their free appropriate education, maybe they have been told that certain services aren't available, maybe that student has been continually steered towards a more restrictive environment, or told that they're going to be put on kind of an alternative curriculum or alternative assessment, families can go to the Office for Civil Rights to help mediate and resolve that problem. And we have nearly more than 50% of the staff have been let go at OCR, and 7 field offices across the country, there are 12 total, have been shuttered. There's already a pretty big backlog of cases to be heard and mediated at OCR, and so this is really only going to lengthen that time. About 2-3 weeks ago, the ARC actually joined in a lawsuit against these actions against the Department of Education, saying that with this reduction in staff, the Department of Education is not able to fulfill their statutory obligations. So the things that the department must do by law, it's written into the legislation, they are not going to be able to do with a reduction in force this large. And the judge actually has blocked President Trump's effort to dismantle the Department of Education. Now we're kind of in a hold. President Trump's team will be appealing that bill, so no one has been kind of rehired or put back into place at the department. But that was certainly a win for us, especially because the ARC joined in on this lawsuit. And there is linked here, ARC CEO, ARC of the US CEO Katie Neese wrote a really great op-ed in Newsweek about how the Department of Education specifically supports students with disabilities. Next slide, please. There's also been some talk about moving the jurisdiction of IDEA, or the Individuals with Disabilities Education Act, so kind of all special education services, out of the Department of Education and to the Department of Health and Human Services. After a couple meetings that we have had with folks at the department, we actually feel like this has kind of moved down the priority list, but it's still very much something that we are watching. You know, it might not sound like a big deal. Like, well, who cares if it's at the Department of Ed, if it's at the Department of Health, as long as the department's doing the same thing. And we really feel that moving the oversight of special education out of the Department of Ed into the health agency kind of moves us backwards into this, back into this medical model of disability that we've, I think, worked so hard, and the IDEA has worked so hard to try and move past in the last 50 years. There is so much. I was a special education teacher, and there is so much knowledge that comes from being able to constantly interact with teachers who are teaching non-disabled students. We're able to, learn from both of each other, and to be able to say, well, this group of students is a monolith, and we can just pluck them out of Ed and put them into HHS, I think really doesn't recognize the value of inclusion and the value of an inclusive education that, the ARC has tried for, its 75-year history to really move forward. The last thing I want to mention in kind of at this education space is last Friday at like 5:20 p.m., we saw President Trump's budget proposal that really kind of fleshed out some of the things that we had seen in kind of the skinny budget a few weeks ago. And one of the things that they're proposing is a pretty dramatic shift in how IDEA is funded. So currently there's a couple of different buckets, right, of money that go to states, and states have to make sure that each bucket of money is being spent on what it should be spent on, right? It's almost like when you think about like your house budget, or, your budget for your household, and you're like, well, I'll spend this much on food and this much on rent and this much on utilities and this much on clothing. What they want to do is they want to take two pretty big programs and put them into this just one giant chunk, this one giant fund. And states don't need to necessarily show that they are spending all that money on those specific things. They kind of just get to say, well, I have $5 million to spend, and I can kind of spend it however I want. And some of the sections that they want to move are what we call Part D. And some of those important things that Part D does is helps train people to become special education teachers, or to help general education teachers get their special education certification. It helps fund the parent and training information centers. There is a parent and training information center, at least one in every single state. And these provide parents and families information on what is an IEP, what is an accommodation, what are your rights under IDEA, how do you advocate for your rights in an IEP meeting. And the other chunk they're trying to move are preschool grants, right? So there are grants that specifically go to preschool age children with disabilities to ensure that we are providing them with all the supports and services they need before they begin kindergarten. This is a pretty monumental shift. And I think continuing this trend that we've seen under this administration of moving things back to the states, which kind of might sound great on its face, but I think in the space of educating students with disabilities, we know that states haven't always done the right thing by students with disabilities when it's been left up to them in the past. Before IDEA was passed in 1975, 50% of students with disabilities were not even in school, were not provided an education at all because schools said, we can't do that, it costs too much, or we just don't want to. So we have some significant hesitancies here in saying everything's going to go back to the states and everything is going to be hunky-dory. So these are some of the education pieces that the ArcUS and me and our team in particular are working on and trying to make sure advocating for all students. Just real quick, things that the ARC has been doing. We are, our team has had over 185 meetings with congressional offices since January. And we're not a super large team. The bulk of them have been done by Kim. So we are constantly meeting with members of Congress, with administration folks to share and uplift all the stories of what is going to happen to people with disabilities for these cuts. We are working very closely with our other disability and aging advocates to kind of build that coalition and to make sure it's not just the ARC that is raising these concerns. And we've been working really closely with specific targeted local and state chapters, especially for kind of members who have been on our target list to, get them to meetings to share their stories. So, all right, I said that we were going to have more time for questions, and unfortunately, I don't think we do, but we have like 3 minutes.
Great, thank you. So there were some questions in the chat about getting a copy of this materials, and a recording of this webinar and all of the handouts are available on the ARC Michigan site. Well, the recording will be available on the ARC Michigan site, and we will go ahead and drop that link in the chat right now. So there were a lot of questions that came through in the chat about understanding what they personally might be qualified for. And that's something that would require individual discussion with you. And you'll see the contact information provided so we can follow up with that. Can you provide some examples of what these cuts might look like? For example, if somebody receives now like $200 a month in food assistance, are you thinking it's going to go down half or a proportionate, or what can we expect?
Robyn, do you want to start?
Sure. I'm not a SNAP expert. We can certainly drop the email of our colleague Darcy, who handles all things SNAP, who might be able to like more effectively answer your question.
Yeah, but part of the answer is that we don't know. I mean, because every state will react to cuts differently. In the SNAP provisions, they're for the first time ever expecting states to what they call get skin in the game, and they're requiring states to do a match, kind of like Medicaid. And they're worried, some are worried that some states will, I mean, not to be a scaremonger, but to give up the program altogether if they can't if they can't make that match. So it depends on how states react to all of these cuts. Some states are already trying to do that. They're trying to guess what's going to happen, and they're trying to figure out what their state budget should be. But definitely there's just going to be more if this bill passes, and we are working very hard to prevent that from happening. But if it happens, then states are going to, advocates at the state level will have to push their governors and state legislators to try to make up for the cuts.
Right, we'll do one last question. I know we're quickly running out of time, but there's a lot of comments in the chat about better understanding the work requirement.
Right.
There's an understanding that a large percentage of folks are already working. So any insight on that?
So I saw those, and so I put in the chat an issue brief on the work requirements. And then I also found, while Robyn was talking, I found the ARC's summary of the reconciliation bill that has some specific language around the work requirements and the exemptions that are provided. Again, exemptions are hard and they often don't work, but at least we do have exemptions for people with intellectual and developmental disabilities, as well as caregivers.
All right. It looks like our time here is just about up for today. Thank you so much, Robyn and Kim, for joining us. Thanks, Robyn. Thanks, Kim.